Welcome back to American Medicine Today. I'm Kimberly Bonati alongside Dr. Bonati, and we see a lot of individuals that come to us with cervical and lumbar spine pain. What is it we need to understand about those issues?
The population of pain on the cervical spine and the lumbar spine is enormous. It's around 1/3 of the human race affected by this problem. We need to analyze why this happened. And usually the pain is progressive. People who has neck pain, for example, or back pain, initially have some discomfort. And then they ignore those ones because it goes away. And then they live many years with that. And then they continue, suddenly the pain becomes a little more erratic, more intense. And this time they use some medication like Tylenol or aspirin or something like that. So years go by, and then this time the pain becomes intense, and the patient starts to use braces. And then later on, suddenly one day, the pain is extremely intense. It's so intense that the patient is being thrown in bed for 2, 3, 4 days, and then gets better. At that time, the patient starts to realize that really has a problem on his back. Because before was something that appeared, disappeared, appeared, disappeared. Now this one, it was pretty bad. We don't really know what the cause of that, because it's not unique. This is not a type of a disease that we can take a look at this one. It's like a syndrome, affects different areas. This individual now who has this pain can be associated with degenerative disc. The degenerative disc will give you back pain or neck pain. Now, can be also associated with the spinal stenosis. Spinal stenosis will give you back pain and neck pain. Can be associated with herniated disc. That will also give you neck pain and back pain. So there are different types of situations that they affect the cervical and the lumbar spine that they can create neck and back pain.
So when you say you have neck pain, it's not necessarily only the neck. It can be a pain that radiates into the shoulder, into the arm and the hand, causing weakness as you go to grip. You won't have the strength or weakness. And as far as lumbar, it can actually radiate into the buttocks, the hip, and the knee, and down into the foot. So it's not only that it would just be neck pain or back pain, correct?
What you are doing is you are identifying that the neck pain is not only neck pain. The neck pain can be a cause created, but what that problem can go together is with an irritation of the specific nerve. And then that specific nerve will give you the pains that you are describing. Will go to the arm or will go to the leg.
So you see a lot of patients sometimes that think they need a shoulder replacement or a hip replacement or a knee replacement. And it turns out that it's none of those things. It really relates back to the spine.
When you have a training, and the training, really you have a good training in neurology, and you have a good training in orthopedics, then you can identify, for example, the problem and say, this is really a damage on the muscles and on the bone, or you can divide, this is a nerve problem. That's why always when you have a shoulder pain, you just don't tackle the shoulder and get an MRI of the shoulder and x-rays of the shoulder and then go and decide that you're going to do surgery there, because you may be missing a cervical disc that's creating the pain. So the diagnosis of this is very important. And if you don't do it right, then you're going to be operating things that you shouldn't be operating. I have people that sometimes have surgery on the hip, and then they replace the hip. And then the patient come back to me and say, I still have some pain on my hip. But the pain is coming from the spine. And if they will do the diagnosis before, then they would not replace the hip. That's why the education in the medical schools, they need to be very intense to physiopathology and anatomy, because then you will be able to put together things that usually don't.
So you talk about cervical spine pain, but that can actually trigger headaches. Is that correct?
If you have a problem on the cervical spine, it's not unusual to see people that they have a car accident and they have a whiplash injury. And that whiplash injury, they have a horrible headaches for 7 months. And then suddenly the headache disappears, but still the arm pain and all the other things remain. The problem there is that can be treated in 1 day. If you just go and decompress a little bit and protect the area of the dura, then the headache is gone, right? But the people are not treating in that way.
No, because they're prescribing the medications.
What they do is they do therapy, they do physical therapy, they do pain management, and the real truth, the patient is just with a lot of time, lots of work, lots of family relationship, and all this, because constantly are in pain.
And they're also being told by doctors that it's all in their head.
They are going to select the patient that can have the surgery, because those patients that they have emotional situation, family problems, economical problems, patients that they're not stable, things like that, those patients, don't touch them. So wait a minute, those are the patients that they are unstable because of the pain. They are unhappy because of the pain. They don't have money because of the pain. So you need to go ahead and focus on those ones.
Well, let's hope they find a better solution than only treating a subsection of all those that are truly needing medical help. Well, that's all the time we have for this episode of American Medicine Today. Make sure you check us out again next week, and you can search us on all your favorite streaming apps. Keyword AMT.